the drug profile regarding like uses or adverse effects or contraindications of this drug. And lastly, you have to learn about what are pre-anesthetic drugs and what are the clinical importance of this group of drugs in anesthesia. Okay, that will be the learning objectives for today's class. So firstly, as we see in the picture here, that before the discovery of anesthesia, okay, your surgical procedures or surgical operations or major surgeries were conducted with very great suffering and emotional distress. Okay, these pictures are actually showing the emotional trauma and distress that the persons have to undergo before the discovery of anesthesia. Okay, and therefore we say that the anesthesia is a very, very important part of the surgery, as it enables the patient to undergo these kinds of horrific procedures and the surgeries very safely, okay, without experiencing so much of distress and pain. Still, this major surgeries is kind of an experience with a roller coaster rides of emotion, emotional distress, and it's a nightmare today too, but it has, because of the discovery of the anesthesia, the surgical procedures and major surgeries have way been better because of the discovery of the anesthetic drugs. Okay, and these anesthesias were discovered first by a dentist himself, whose name was Horace Wells. Okay, he pioneered the use of nitrous oxide, which is a very important element in the dental practice for carrying out the surgical procedures. Yet even another dentist and a medical student named as Morton, okay, he gave the demonstration of yet another use of the general anesthetic, which is called as ether. Okay, and the first IV anesthetic used was thiopentin, which was introduced way back in 1935. Okay, so with the discovery of this anesthesia, now the procedures, the major surgical operations or procedures have been distress-free and also pain-free. So coming to anesthesia, so this we can divide anesthetic drugs into two. Okay, so one is called as local anesthetics, and the another one is called as general anesthetics. So they have a major differences in them. So you see, you have to picture one kind of surgeries as the major surgeries, like your surgeries related to your visceral organs, like your MI surgeries and other major surgeries, you know, and the other tiny, it's minor surgeries. So general anesthesia is mainly applied for your major surgeries, whereas local anesthesia are used for restricting only the restricted part of the body, not the whole body. Okay, so you see the basic difference is that your peripheral local anesthetics are acting on the peripheral nerves, so that they are anesthetizing certain areas of the body only, like for example your fingers, you know, hand or anything like that, whereas general surgeries, they are acting through the CNS. Okay, therefore they will be anesthetizing whole body. So local anesthetics are only anesthetizing the restricted areas of the body. So since CNS is involved in general anesthetic, your consciousness will be lost when the general anesthetics are applied, whereas in case of administration of local anesthesia, your consciousness is not kind of altered. So general anesthetics are mainly applied for major surgeries where everything you need to be is needed to be in control, whereas your local anesthetics are mainly used for minor surgeries like day care surgeries, or you know, which can be carried out easily for the restricted areas of the body. And for the use in the non-cooperative patient, it is local anesthesia will be possible, whereas if they are not cooperatively from their health-wise, like general anesthesia, it's not possible. So therefore the use of local anesthesia in poor health patient will be much safer, because we are only anesthetizing certain areas of the body, and because in general anesthetics your whole of the CNS is getting involved to anesthetize whole of the body. Okay, so if the patient is having a poor health condition, that will be a risky approach to that. So therefore, before giving general anesthetics, the whole systems like your circulatory, breathing mechanisms and all of those systems will have to be screened first before administering general anesthetics, whereas that is not necessary if you are administering the local anesthetics. Okay, is that clear?
Yes, ma'am.
So today we'll be discussing only about general anesthetics, and in the next class there is a topic for a whole 1 hour discussion for your local anesthetics. So we'll be completing general anesthetic today. So we now know that general anesthetics are used, they are administered and whole of the body is anesthetized, and they are working through the CNS, that is your central nervous system. Okay, so this kind of anesthesia is called as a reversible state, because when you withdraw the drug, you are recovered to the normal surroundings. Okay, so that is therefore is a reversible state of the central nervous system depression, that is resulting in loss of response to and perception of external stimuli. Because you see, when you are conducting the major surgeries, you have to make patient comfortable in a sense that they don't feel pain. That is called the criteria is analgesia, and they are not responding to external stimuli, because if they are going to kind of express their thing for a kind of external stimuli, then that will be a very, very difficult task to do. Okay, so this abolition of reflexes, and main thing that there should be a painless procedure. Okay, so that will be created, this kind of room will be created by the administration of general anesthetics, so that you can perform those procedures or tasks in the major operations. So these are the class of drugs. Okay, so that is used to depress the CNS to that degree, okay, so that they can allow the performance of surgeries to happen. Okay, and for a patient who are undergoing the surgicals, mainly we are talking about the major surgeries rather than the minor surgeries, this kind of drugs, okay, this group of drugs, that is the general anesthesia, they should be able to provide sedation. Okay, because without sedation, it will be a very difficult job to carry it out. Also, reduction of anxiety. Next is lack of awareness and amnesia. Next is skeletal muscle relaxation. Okay, the muscles should be relaxed to carry out those major surgeries. Okay, otherwise, because of the repeated contraction of those muscles, your kind of it will be a very it will impossible job to do. And also suppression of undesirable reflexes. Okay, we have to make sure that the patient is not responding to the external stimuli, and a very, very important thing is that it should be painless. Okay, so everyone who is undergoing the major surgeries, okay, they are given they are administered with a group of drugs, that is your general anesthetics, which will depress the CNS to that degree which will allow the surgical operations or surgical procedures to be carried out. Okay, and for that, all of these drugs, they should be able to create these features. Okay, one is loss of sensation, next is sleep, okay, and amnesia. Next is immobility or muscle relaxation, and inability to react to external stimuli, that is abolition of reflexes. This should be your both somatic as well as autonomic. So all of these drugs, they should have these three important characteristics. They should be able to create unconsciousness in the patient. They should be able to create the painless room for surgery, and also the amnesia, that is like not allowing them to recall those memories so that your experience of surgery is not a nightmare, not the nightmare one. Okay, so these are the three triads for the general anesthesia. So for a practical approach, okay, we now know that what these drugs do, Manira. So for practically, if you imagine, okay, whenever a patient is undergoing the surgical procedure or surgical major operations, okay, these steps are to be followed, okay, because you know your general administration of general anesthesia is not an easy task. Okay, you can't give it to anyone like that. Compared to your local anesthetics, you have to observe the patient reactions or history or hypersensitivity reactions and all, and you have to screen for all the systems like your circulatory system, your respiratory system, GI systems and all that, so that no further hindrance will be there when you are carrying out those surgical, tedious surgical operations or major surgeries. Okay, so these are the protocols that you should be taking on step by step when administering the general anesthesia while undergoing major surgeries. Okay, so first there will be pre-operative assessment where all of the systems in the body will be screened if they are kind of working, if they are in a bad phase or if they are in a good phase, त्यो सबै screeningहरू चाहिँ it is the first step to be carried out. The second step is the use of group of drugs, which is called as pre-anesthetic medication. So now shortly we'll be knowing what a pre-anesthetic medication भनेर. So when the person is fit, for administering the general anesthetic only then you will be giving the pre-anesthetic medication, and then after, while administering the anesthesia, that is the general anesthesia, it is done in two phases. Okay, first there will be the phase of induction, okay, where the anesthesia will be induced by using the IV anesthetics, obviously, because IV one, but they have the faster onset of action. Okay, so because of that, obviously, for the induction of anesthesia, just started with IV anesthetics. So if the surgical procedure is longer, it's going to take a very long period of time and you have to maintain it, then IV anesthetics alone cannot do it. Okay, and for that you have to maintain with the help of the inhalational anesthetics. Okay, so basically your general anesthetics has been divided according to your inhalational anesthetics and the IV anesthetics. Okay, and after the induction of anesthesia, now the surgeons will be performing the surgical procedures. Okay, and when the task is over, you withdraw this anesthesia and the patient are recovered to the normal surroundings afterward. So this is the steps that is taken under consideration while giving the general anesthetics. So now coming to pre-anesthetic medication. So pre-anesthesia means before anesthesia. Okay, so the name, as the name suggests, okay, it is obviously the group of the drugs that should be given before administration of the induction of the general anesthetics. Okay, so the use of drugs prior to the administration of an anesthetic agent is called as pre-anesthetic medication, and the main objective of giving this kind of group of the drugs is to make the surgical procedure more safer and more agreeable to the patient. Because you see, your surgical procedures or your major operations are always a kind of related to your the persons undergoing them are experiencing a lot of emotional distress, and it's like a nightmare to them. Okay, so there is anxiety associated with apprehension associated with they will be undergoing through a lot of pain. Okay, even your reflexes like your vomiting, nausea, होइन तिम्रो स्ट्रेसले गर्दाखेरि gastric ulcer development is all possible before your surgical procedures is going to get started. Okay, to elevate all this with the motive of controlling all these things. Okay, to make the surgery more safer and agreeable to the patient, group of drugs are given. So the aims of this medication will be to elevate anxiety and apprehension. Okay, to reduce autonomic effects, because one of the main objective of administration of general anesthetics is also to abolish the reflexes, your both somatic and autonomic. So त्यसको लागि पनि this group of drugs are given to relieve the pre and post operative pain, to have anti-emetic effects, and to prevent gastric ulcer secretion and stress ulcers. Okay, so this will be the main objectives of pre-medication, and the drugs where it is used will be to elevate the sedation and apprehension and anxiety. Sedative drugs can be given. So these drugs are your benzodiazepines such as diazepam or lorazepam or midazolam. So these drugs, अहिलेको लागि just remember this name of drugs. Okay, eventually this group of the drugs will be taught to you in your sedative and hypnotic group of the drugs. Okay, so just remember the name for now. अर्को चाहिँ to abolish the cholinergic reflexes, we give the drug like atropine and glycopyrrole. You have already been familiar with this group of drug, which is an anticholinergic drug. So to relieve from pain and pain associated with the surgeries, okay, opiate analgesics, these are also coming up in your upcoming classes. Okay, so morphine and incognitors. We know anti-emetic drugs, therefore controlling nausea and vomiting, especially drugs like metoclopramide, domperidone, and ondansetron are given. And to kind of control the stress-induced ulcers or peptic ulcer, mainly your H2 blockers or even your proton pump inhibitors can be given. These are drugs are your ranitidine and famotidine. Okay, is that clear? So this is a very important kind of question. Short note questions you can be asked to write about your pre-anesthetic medication. Short notes whenever you can be asked. Okay, so please prepare a note for yourself regarding the pre-anesthetic medication. This is frequently asked even in your university examinations or MAPANI. These are the frequently asked questions. Okay, is that clear?
Yes.
Okay, now coming to the stages of anesthesia. Okay, we gave the pre-anesthetic medication. Now we are going to administer the general anesthetic drug. Okay, so anesthesia will be achieved in four stages. Okay, there are four stages that is described where when general anesthesia is given. And you see this was first demonstrated by a scientist named Gödel, so therefore it is also called as Gödel's sign. So there are stages which is also unwanted there. Okay, so if it can be only seen, all the stages can only be seen in a slow acting drug, like in case of ether. Okay, so let's see the stages. Okay, so these are stage 1, stage 2, stage 3, and stage 4. Okay, so first is the stage of analgesia. So as soon as you are administering the general anesthetic drug, the person will feel first the person is experiencing is the painless experience, and that is called as stage of analgesia. So this is followed by your stage of excitement and delirium, where person is more kind of violent and combat in behavior. Okay, and it is made sure that this stage is escaped because this is a stage where we don't want patient to be kind of being a violent I know this stage is actually escaped with most of the sophisticated and most of the modern group of drugs. But if you see with the ether, okay, that is a slow acting drug. You can see that in ether also. So the one which is needed is your stage 3, which is called as stage of surgical anesthesia, where surgical where the anesthesia is so much sufficient that you can carry out those major procedures that is wanted. And if you are continuing the drug in a very overdose kind of situation, your stage 4 also can be reached, which is the stage of medullary paralysis. Okay, so if the stage is going to this level or to this stage, it can actually be unfavorable for the patient. So it is made sure that it is reached up till the stage 3, that is stage of surgical anesthesia. So coming to mechanism of action, so you will learn here that because there are many group of the drugs here, it is not acting only through one sort of mechanism of action like any other drug that we have studied so far. Okay, they can be acting through multiple ways of action. For example, okay, there are drugs called as benzodiazepine, barbiturates, etomidate, and propofol. So they facilitate the GABA-mediated action at GABA receptor sites and thereby increases the chloride flux through its channel. So what is happening is this is, you see, this receptor is your GABA. GABA, this is the receptor for GABA. Okay, so this is your inhibitory neurotransmitter. Okay, and they are associated with the chloride channel. Okay, so when this anesthetic group of drugs, what they do is that they enhance the binding of GABA, which is the inhibitory neurotransmitter, to its receptor, so that more of the chloride ion flows inside, so that the cell is hypopolarized and they are not allowed to depolarize. Okay, and therefore they will be decreasing the neuronal excitability, and that means they will be showing the painless room for surgery. And also other reflexes abolish is because they decreases the neuronal excitability in that. Okay, so this is one of the important mechanism of action for the general anesthetic. What they do is that they enhance the binding of GABA, which is your inhibitory neurotransmitter, so that more of the chloride influx will be there, so more hypopolarization, and therefore the neuronal cells will be polarized cells will be killed. So the depolarization ability will be lost, and therefore the excitability of neurons will also be reduced. Is that clear, or do I have to repeat that again? Are we clear about the mechanism of action? Why isn't anybody speaking? Clear, boyo, or do I have to repeat this?
Yes, ma'am.
So again, the same thing. Okay, so GABA neurotransmitter. So for it there, okay, so they will increase the influx of the chloride into the thing is hypopolarized. Okay, hypopolarized by which the cells will not be depolarized, and therefore they will be decreasing the neuronal excitability in the cell. Okay, so there is another drug called as ketamine, okay, which blocks the action of glutamate. So glutamate is a excitatory neurotransmitter, and you also know okay, first we'll go with glutamate. So glutamate is an excitatory neurotransmitter. So they have their receptors in the postsynaptic neuron, which is known as NMDA receptor. So what this drug do, ketamine, is that they antagonize this receptor. Okay, so ketamine here is antagonizing the NMDA receptor, so that the action of glutamate on the NMDA receptors is not achieved, and therefore it again decreases the excitability of these neurons. The drugs called as enflurane and isoflurane. Okay, so they decrease the opening of the duration of opening of this nicotinic receptor. So nicotinic receptor is for your receptor. It is for which neurotransmitter? Kiko receptor हो nicotinic receptor भनेको बिर्स्यो muscarinic and nicotinic receptors are for which neurotransmitters? So these are for your acetylcholine. Okay, so you know that a neuromuscular plate and all mathimro nicotinic receptors are हुन्छ. So neuron and neuron connection or neuron or muscle plate connection mathimro nicotinic receptors are हुन्छ. So यो पनि opening of these receptors will be decreased, because of which your excitation of your postsynaptic neuron or neuromuscular plate will also not be possible in presence of this drug. So coming to the classification of general anesthetic, as I have told you, there are steps to be followed for the approach of general anesthetic. First, there will be pre-operative assessment or the screening of the patient, and when they fit into being administered with these drugs, they are given the general anesthetic drugs. Now, when given, okay, first there is a phase called the induction phase, and induction phase ko lagi, the onset should be very much fast, and therefore the route use is intravenous. Okay, so intravenous route बाट चाहिँ नि induce गरिन्छ, and maintenance चाहिँ नि inhalational route बाट गरिन्छ. So with the inhalational route, your doses form will be in the form of gases or either your volatile liquids. So gases form nitrous oxide, and this is one of the very important drug or general anesthetic that is used in dental practice. Also your volatile liquids like ether, halothane, enflurane, isoflurane, desoflurane. Okay, so you can easily remember that they are ending in A and E. Okay, halothane, enflurane, isoflurane, desoflurane, and sevoflurane. And for the inducing agent, they are used as very ultra short acting drugs like your thiopentane, methoexytone, propofol, and whereas your other slower acting drugs, which can even make the administration of anesthesia even more longer with the use of slower acting drugs like your benzodiazepines, dissociative anesthesia called ketamine. So this is often asked question, okay, MCQs ma pani and viva tira pani you will be asked what is dissociative anesthesia bhanera. So ketamine is the drug which is your dissociative anesthesia, and you are again asked why are they called dissociative anesthesia bhanera. So के हुन्छ भन्दाखेरि after the recovery withdrawal of ketamine withdraw गरिसकेपछि के हुन्छ भन्दाखेरि they distorts the user's perception of sight and sound, okay, and feeling of detachment. Okay, they are disoriented, kind of more of disorientation even after the withdrawal. But when you withdraw the drug ketamine, even after the withdrawals, for some time they are being disoriented. Okay, and that's why they are called as dissociative anesthesia. So next is your neuro-led analgesia, which is called as fentanyl. First, let us go with intravenous anesthesia. So intravenous anesthesia, as intravenous भन्ने बित्तिकै they should be given through this IV route. Okay, अनि they are given through IV route because induction गर्नको लागि faster route of administration is always your intravenous route. Okay, and they will be creating or producing the loss of consciousness exactly approximately about 11 seconds. Okay, so 11 seconds after the administration of your intravenous anesthetics, the person will be in that zone of painless, okay, in stage 1. So that is there. And after the induction of this anesthesia, it can be maintained if the surgical procedures are going to take a very long or few more hours, then it should be maintained with inhalational anesthesia. Otherwise, when they are supplemented with the analgesics and muscle relaxant, they can be also used as a sole anesthetic agent if the surgical procedures will be of a very shorter period of time. So intravenous anesthetic agents, and again, they are of two categories. The faster acting drugs, which are more of given through your for the induction, like thiopentane, methotrexate, propofol, and etomidate. And others are also given like benzodiazepine, dissociative anesthesia, and opioid analgesia. They are much like slower acting. Okay, so compared to the duration of action, they are divided likewise. So can you now say why ketamine is known as dissociative anesthesia भनेर? अघि भर्खरै we have discussed why ketamine is known as dissociative anesthesia भनेर, हैन? So somebody please answer this. Nobody understood why ketamine is called as dissociative anesthesia भनेर?
Ma'am, even after the withdrawal of this drug, patient will feel a dissociation from the surrounding body and surrounding.
Yeah, they feel like they are disoriented from the surrounding, okay, environment and oneself. They are disoriented, okay, they distort the perception of sight and sound and produce a feeling of detachment, like they like don't feel like normally orientation huncha after the recovery. That is not seen with ketamine, and the period of disorientation is longer for ketamine. That's why they are called as dissociative anesthesia. So coming to individual drugs, okay, I have already listed the name of the drugs that you should be knowing the drug profile of. Okay, so thiopentane is one of them. These are called as ultra short acting drugs. So if you remember the general pharmacology, some of the drugs undergo redistribution. Okay, भनेको मतलब after their administration, okay, they will be entering the highly soluble phase मा जान्छ, like त्यसले गर्दाखेरि चाहिँ तिनीहरुको duration of action is very short. Okay, please go and have a look to the topic called as redistribution. Okay, so because thiopentane undergoes redistribution, okay, they are redistributed in the body, they have a very short duration of action, so therefore they are called as ultra short acting drugs. Okay, coming to mechanism of action, these are GABA facilitatory. So can somebody say what does it what के भनेको GABA facilitatory कसरी act गर्छ? We have already discussed this in mechanism of action. What do you mean by GABA facilitatory? How will it work by facilitating GABA?
Ma'am, GABA facilitates the chloride ion influx, and with this drug, more chloride ion influx is there, which will lead to fail of depolarization,
Okay.
and then it will that neuromuscular transmission will.
Yes. So GABA facilitator mean it enhances the action of GABA on its receptor. Okay, so GABA is associated with chloride, receptor is associated with chloride channel. So when binding of GABA is enhanced, there more of the chloride ions influx will be inside the cell. Okay, we are talking about neurons here. अनि के हुन्छ, the neurons will be hyperpolarized भएपछि depolarization ability will be lost, and therefore it loses its neuronal excitability. Okay, so please go through this. Okay, And it also, therefore, by this way, okay, it will be depressing the reticular activating system, which is a system in the brain that controls the consciousness, and this is how the consciousness will be lost. Coming to pharmacological action, they are analgesic. Analgesic means they are able to provide painless room for surgery. They are also an anticonvulsant drug. Okay, I said in second stage your violent behavior will be achieved. So being an anticonvulsant also in early that can be an advantage, and also it can be used to treat other disease conditions related to convulsions and jerks called as epilepsy. They are also myodepressant, that is, it depresses muscles. So that will be again an advantage to carry out surgical procedures, because we don't need any reflexes relating to skeletal muscles being carried out during surgery. These are weak muscle relaxant, and however they are found to cause respiratory depression. Okay, and uses, then it is always induction of general anesthesia, because these are a very ultra short acting drug. They have a very short duration of action, so it is only used as anesthetic for induction purpose. And since these are also used to control seizures and convulsions in epilepsy, they can be used for a condition called as refractory status epilepticus. Now, with the ADR, since they cause a respiratory depression, that will be one of the important ADR. They also cause post-operative disorientation, but compared to ketamine, this is very much less. So the name ketamine, the name dissociative anesthesia is exclusively used for the drug ketamine. And since they are given through injection, okay, the IV route, if that is not happening correctly, the surrounding tissues can undergo necrosis, and even gangrene, ulceration, and thrombophlebitis can also occur. So these are contraindicated in blood disorders like porphyria, hypersensitivity reactions, and even in hepatic and renal disease also. So next drug is your propofol. So mechanism of action is again GABA facilitatory. That is again it enhances the binding of GABA on its receptor, opens up the chloride channel. More of the chloride will be going inside the cell, neuronal cell, and therefore more hypopolarization, no depolarization, and therefore it reduces the neuronal excitability that is there. Okay, so compared to propofol, it is not an analgesic drug. They are only creating a stage of anesthesia there. So with the use of propofol, you have to again administer other analgesic drug also. These have no anticonvulsant action like that of thiopental. So this is not the drug of epilepsy and all. Also, it creates cardiovascular and respiratory depression. So these are the agents for users. These are the agent of choice for total IV anesthesia. Okay, if you are if you have to choose one of a drug for a very short surgical procedure, propofol will do, because propofol will be the choice. Okay, so this is the agent of choice for take here, and in use for, because they are shorter acting drugs, they are used for induction of general anesthesia. So since they cause the respiratory depression and serious depression, they can cause apnea, hypotension, and with the IV injection, they can be painful injection. So contraindication will be obviously in the cardiovascular diseases and cerebrovascular diseases. Okay, also they are contraindicated in hypersensitivity reactions. So next drug is ketamine, which is also very much commonly known with the name as dissociative anesthesia. So these are your NMDA receptor antagonists. So there is a inhibitory. There is a neurotransmitter called as glutamate. So it antagonizes the receptor NMDA for glutamate, so that no further excitation of the neurons is possible. So these are also strong analgesic drug. The other thing that you have to remember for ketamine is that this is called as dissociative anesthesia because of the disorientation or disorientation that it causes after the recovery or emergence reaction. Also with that, it causes sympathetic stimulation also. So they are mainly used for head and neck surgeries because they are longer acting drugs or slow acting drugs. They can be used for this group of surgeries along with the induction along with the inductions, and also to during the diagnostic procedures or like your angiographies, cardiac catheterization and trauma surgeries, or they can be used with other sedative drugs, okay, to carry out those painless procedures. So ADR will be most common that you shouldn't be forgetting about ketamine is that since it is a dissociative anesthesia, hallucination, disorientation will be a very common thing with ketamine. So we can also keep it as emergence reaction, and they are also found to have increased since they are most commonly used for head and neck surgeries. They are also found to have increased intraocular and intracranial tension when they are used for this kind of procedure. So we have induced a patient with the induction anesthetics, that is through the IV route, and now we have to maintain the anesthesia with the help of the inhalational anesthetics. So these are used primarily for the maintenance of anesthesia. You see, this is the route through which through the marks or through the cannula, inhalational drugs can be used, okay, after giving the intravenous agent, and this is the pathway for your inhalational general anesthetics, okay. Through those marks, your inhalational drug will first reach the lungs, and from the alveoli and blood barrier, they will be going to the blood circulation, and from that to the arterial blood, and will be going to the brain, okay. And similarly, the same pathway will be followed when they are withdrawn, okay, when the marks is withdrawn. So same thing is going to happen. First from the brain, they will be going to the venous blood circulation, and from this they will be going to the alveoli of the lung, and they will be expired out, okay. So there are certain characteristics of inhalational anesthetics that you should have only the basic kind of knowledge about, okay. So you don't need to go into much more detail of those characteristics, but के हो भनेर चाहिँ नि basics idea चाहिँ नि you should have in your mind. So one thing is called as median alveolar concentration or MAC value for the drugs, okay, and AC value. So what is MAC भन्दाखेरि, MAC is the lowest concentration of the anesthetic in pulmonary alveoli. So you see why the picture is important is तिम्रो inhalational agent or tinदाखेरि they will be first through the inspired air, they will be going into the alveoli and then to the blood and then to the brain, you know. So that lowest concentration of the anesthetic in pulmonary alveoli, that is needed to produce immobility. So that is immobility भनेपछि we are talking about anesthesia here, in response to a painful stimulus, that is a surgical incision in 50% of the individuals. So this will be corresponding to your amount of the drug that will be used to create the anesthetic room. Are you getting the point? So MSC भनेको चाहिँ it is the lowest concentration of the anesthetic that is, okay, needed to produce the immobility, that is needed to produce the anesthesia in 50% of the individuals, okay. So this is nothing but, okay, they are kind of assessed through the numerical values, okay, and this is nothing, they are more of like giving you the concept of the potency of the anesthetics. So if you remember your potency term from your general anesthetic drugs, so potency and efficacy, there are two things, you know. So potency भनेको चाहिँ it is the amount of the or concentration of the drug that is needed to produce some kind of response, you know. Efficacy भनेको that is also your amount which is required response भन्दाखेरि required response produce गर्नलाई कति amount of drug चाहिन्छ, that is your efficacy. And the lowest one, which is the response which is achieved through the lowest amount is called as your potency. Okay, so same thing applies here. Potency of the drug. Okay, so MSA value is the correspondence to your potency of the anesthetic, and it is only the thing कि your potency चाहिँ नि यहाँ numeric value ले represent गरिरहेको छ. Is that clear? बुझेछ कि I should repeat that? Are you clear? Representation of the potency of the drug in your kind of numeric value. Okay, and here greater the MSC value, lesser will be the potency of the drug. So if you, let's compare halothane, you know? So yeah, halothane ko chai ni timro MSC value is 0.74 so, you know? And if you compare it to the greatest value MSC, that is nitrous oxide, is 104. So what does this mean is that halothane has the MSC value 0.74, that is less compared to your nitrous oxide, which is 104. So potency wise, which will be more potent above? Greater the MSC value, lesser will be the potency, you know? So lesser the MSC value, greater will be potency. So which one will be more potent, halothane or nitrous oxide?
Halothane.
Okay, so that will be halothane. Okay, it's nothing but representation of the potency value in the numericals. Okay, so next characteristic that is there for the inhalational agent is blood gas partition coefficient. So it is nothing but the index of solubility. Okay, so how much amount of or the concentration of the drug for a particular drug is there in the blood compared to the lungs or the gas compartment ma kati cha bhanera त्यसलाई measure गर्ने, it is one of the index. Okay, so it defines the relative affinity of an anesthetic for the blood compared to that of inspired gas. So blood ma कति amount हुन्छ and तिम्रो gas, that is lungs ma alveoli ma कति amount of drugs हुन्छ भनेर it is comparing that. Okay, so के हुन्छ त अब if a drug is highly soluble, okay, highly soluble भनेपछि blood को compartment ma it is going to remain for a very longer period of time, you know. So that means तिम्रो gaseous level ma जानलाई, that is in the alveolar level ma जानलाई, it will be taking more of a time because they are more soluble in the blood compartment, you know. So this is a tool which is used to determine the speed of onset and recovery of the anesthetic drug. So again, we are comparing halothane and nitrous oxide here. Okay, halothane ko blood gas partition coefficient is 2.3 so, okay, or let's say 2.4, whereas nitrous oxide ko chai it is around 0.47. So what does this mean is that halothane ma blood ma amount of concentration in there is 2.3 times more than that of your alveolar compartment. भनेपछि तिम्रो drug halothane will be remaining in the blood compartment for longer time or a shorter time. So if it is 2.3 compared to 0.47, timro blood concentration coefficient, so it means that halothane will remain in the blood compartment for a very longer period of time. You know, obviously 2.3 times concentration at equilibrium, we can compare that. Okay, so this means that halothane will have slow onset of action because they are being there in the blood compartment for a very longer period of time compared to nitrous oxide. Okay, nitrous oxide coefficient ratio is less, means they will remain in the blood compartment for a less period of time and coming to the alveolar compartment very faster. So nitrous oxide will have a very faster onset of action compared to the halothane. बुझेको? So comparison गर्दाखेरि अब desflurane को 0.42 so they will have a very faster onset of action compared to 0.47 for nitrous oxide, compared to sevoflurane, which is 0.75, and the one having the most soluble in the blood, that is halothane, 2.4 so therefore they have a very slower onset of action. Okay, so that means lesser the blood gas partition coefficient, higher will be the speed of onset and recovery. Okay, so you don't have to like this, these are like के भन्ने त्यस्तो डिटेलमा जानु पर्दैन यो एरियामा, जस्ट के हो भनेर चाहिँ नि त्यति बुझ्दा हुन्छ. ओके, okay, so we'll go with the individual drugs. Okay, so nitrous oxide. Okay, so this is the one of the most important group of the drugs used in dental practice. Okay, so they are strong analgesic action, they have rapid induction and recovery. So can you say now why they have rapid induction and recovery bhanera? Because their blood gas partition coefficient will be lesser. Okay, so use her. So they have no adverse effects on CVS, respiratory, kidney and liver, and they also don't have any arrhythmogenic potential, which will be very kind of advantageous. And because of their MAC value, you know, जुन चाहिँ नि about 104, so they are less potent. Okay, less potent, but you have to be using more amount of the drug to produce those anesthetic effect. They don't have any kind of bronchodilatory effect. So एउटा कुरा छ, it is called as carrier and adjuvant drugs, because nitrous oxide के हुन्छ भन्दाखेरि because of their blood gas partition coefficient ratio which we have talked, they produces the faster onset of action. Okay, so nitrous oxide is used as a carrier gas for halothane, हैन, किनभने halothane को चाहिँ नि के हुन्छ, more potent हुन्छ, तर onset of action र recovery will be slower. Okay, because of their blood gas coefficient ratio. So त्यो गर्दाखेरि के त्यो भएकोले चाहिँ नि it is done managed in some way कि तिम्रो nitrous oxide is combined along with halothane, so that because nitrous oxide को चाहिँ नि faster onset छ, it will be carrying the halothane along with it, so that halothane can also reach very faster in those alveolar portions. Okay, so they are mainly used for that purpose as carrier and adjuvant gas, and they are mainly used to maintain the surgical anesthesia. Dental purpose को लागि चाहिँ they can be used as sole agent for anesthetic procedures. So now ADR मा चाहिँ megaloblastic anemia हरू छ. Okay, so that will be ADR. So now halothane भनेको another kind of your inhalational agent. So these are potent anesthetic because in your MSC value it is lesser. So lesser the MSC value, more potent will be the drug. So it is a bronchodilator, so it will be a very effective drug to be used in an asthmatic individual. So slow induction and recovery because of their blood gas partition ratio. So I'll not be talking about that again. So ADR ma चाहिँ they produce a typical kind of inflammation of the cells in the liver, which is typically called as halothane hepatitis. यो चाहिँ एकदमै important thing to remember. Okay, halothane causes halothane hepatitis भनेर. So I have already तिमीहरुको hepatotoxic drugs मा पनि already how halothane causes halothane hepatitis भनेर already भनिसकेको छ होला. So I'll not be going into detail about that. So they are producing a syndrome called as malignant hyperthermia. So this is a very kind of के भन्ने emergency situation पनि आउन सक्छ with the use of halothane. Okay, so malignant hyperthermia को बारेमा चाहिँ we will be talking shortly. So यो अघि नै मैले I have talked about the thing that why nitrous oxide is combined with halothane भनेर हैन. So के हुन्छ त, why nitrous oxide is combined with halothane? What is the advantage of combining these two together? Can somebody say?
Nitrous oxide is a halothane carrier, so because nitrous को चाँडै अनसेट हुन्छ त्यसैले beneficial हुन्छ.
Okay. So अघिको यसमा चाहिँ नि the thing is that the MSC value of halothane तिमीले MSC compared गर्दाखेरि चाहिँ नि MSC value for halothane is 0.74 compared to nitrous oxide 104 हैन. So potency compare गर्दाखेरि चाहिँ नि तिम्रो more potent drug is a halothane compared to nitrous oxide. Okay, so nitrous oxide alone use गर्दाखेरि तिम्रो you have to use very much high concentration of the drug. And also disadvantage with halothane के छ भन्दाखेरि being a very potent drug हैन, it cannot reach or create the speed of onset is very much slower. Okay, so के गरिन्छ भनेपछि दुईटैको advantage disadvantage mix गरेर एउटा strategy चाहिँ के create गरिएको छ भन्दाखेरि nitrous oxide चाहिँ नि they have faster onset of action, but halothane has slower onset of action हैन. Nitrous oxide is very less potent drug, whereas halothane is very much potent drug. So if you combine these two drugs together, nitrous oxide ko onset speed of onset very much faster they will carry halothane along with it, so that halo can also have this onset of speed faster and halothane when they reach into the compartment more faster, it can be used. The halothane concentration is very much lesser because of its potency, so it can be used like that. So यसो गर्यो भने चाहिँ नि के हुने भयो तिम्रो nitrous oxide को र halothane को dose पनि concentration पनि you can use it very lesser concentration and lesser concentration भएपछि side effects of these drugs is going to be reduced. त्यही भएर risk of तिम्रो halothane hepatitis हैन, अर्को के थियो ATR malignant hyperthermia को risk पनि we can slow it down, or you can के भन्ने the risks can be made lesser. So this thing is called as your second gas effect. Okay, your second gas भनेको your halothane. Nitrous oxide is carrying halothane along with it to create a faster onset of action for halothane, and this effect is called as second gas effect. So your type of question or तिमीलाई short note question or define in one define the term भनेर चाहिँ you can be asked. Okay, so prepare गर्दा हुन्छ यो second gas effect हैन. So nitrous oxide rapidly diffuses, whereas halothane rapidly diffuses very poorly. So when these two drugs are administered simultaneously, halothane also enters the blood rapidly along with nitrous oxide. So it's like carrying the second gas along with nitrous oxide, and therefore this effect is called as your second gas effect. So next is diffusion hypoxia. So nitrous oxide ले faster onset of action गरे पनि यसको disadvantage के हुन्छ भन्दाखेरि चाहिँ नि when you withdraw the drug recovery हुँदाखेरि when you withdraw the drug तिम्रो hypoxia हुने chance with the nitrous oxide is very much high. Okay, so के हुन्छ nitrous oxide has low blood solubility, because of which they have faster onset of recovery as well as faster onset of action. So when the administration of nitrous oxide is discontinued, again remember the pathway for those picture, remember that. Okay, so it rapidly diffuses from the blood into the alveoli. Okay, blood butter alveoli they will be rushing very faster, and this causes the marked reduction of partial pressure in the alveoli, because there will be more of the rushing of the drug from the blood compartment into the alveoli, so the pressure in the alveoli will be reduced, because of which they will be creating a sort of situation like hypoxia. And since this is because of the diffusion of the drug from the blood compartment into the alveolar region, this is called as diffusion hypoxia. So you can see तिम्रो onset of action पनि faster छ. So यो चाहिँ onset of action को लागि भयो. So recovery गर्दाखेरि तिम्रो alveolar compartment मा आउँछ हैन, through the blood compartment alveolar compartment मा आउँदाखेरि there will be, because of the faster recovery, your drugs they will be rushing into the alveolar more faster. more concentration of nitrous oxide यहाँ हुने भएकोले चाहिँ नि a situation of hypoxia will be created, which is called as diffusion hypoxia. Is that clear? This is all because nitrous oxide, they have the faster onset of recovery as well, because in your blood solubility is very much less. And it is not seen with any other drug like your halothane. They are exclusive for your nitrous oxide because they have less blood solubility. Okay? Is that clear? Is that clear?
Yes, ma'am.
Okay, so finally, with the adverse effects of inhaled anesthetics, this can have nephrotoxic effect, mainly your drugs from your volatile one, that is enflurane and sevoflurane. They are more of nephrotoxic drug. They also have shown to have a hematotoxic effect, especially with nitrous oxide. So poor ventilated room, if the persons are exposed to nitrous oxide for a very longer period of time than prolonged exposure, they have been found to decrease the activity of an enzyme called as methionine synthase. Okay, so with the lack of the activity, the person can even land up in megaloblastic anemia. Okay, so this can be regarded as the occupational hazard with nitrous oxide. So that should be about nitrous oxide to prevent this. Okay, that there should be shorter exposure to nitrous oxide, and also the room should be well ventilated. So I have अघि मैले एउटा term ल्याएको थिएँ that is malignant hyperthermia. So can you remember which drug it is associated with भनेर malignant hyperthermia? Which drug was malignant hyperthermia associated with?
Halothane.
Halothane. Okay, very good. So please remember this. Okay. So with the halothane, they can give you, they have the risk of causing this very life-threatening and emergency situation, okay, which is called as malignant hyperthermia, and it is not seen in any type of patient being administered with halothane. There is a certain group of individuals, like pharmacogenetics in your general pharmacology, that there are certain susceptible groups in the society, which are genetically vulnerable group. Okay, so this is kind of your heritable genetic disorder in the skeletal muscle, okay, which are more susceptible to halothane. There is this is a cell, okay, and sarcoplasmic reticulum, there is a receptor for controlling the efflux of the calcium into the cell intracellularly. There is a receptor called as ryanodine receptor, which controls the flow of the calcium into the cell. Okay, are you getting the point? So sarcoplasmic reticulum, there is a pump and there is a receptor called as ryanodine receptor, which controls the flow of your calcium into the cell. Okay, so your case ma ke huncha bhandakeri your ryanodine receptor is abnormal. Okay, so abnormal bhayepachi this ryanodine receptor it keeps allowing the calcium into the intracellular space, because of which the intracellular concentration of the calcium goes on increasing. Okay, and when calcium is very much high inside the cell, okay, they give you very increased temperature, elevated temperature, increased muscle metabolism increased by it, like you can see in myofilaments, muscle contraction will be more intense and more will be there. So rigid muscles will be there, muscle destructions, and muscle cells will be destroyed much more faster, which is called as rhabdomyolysis, and even your cardiovascular stability pani disrupt. Okay, so this is very fatal condition and even life-threatening situation, emergency situation. So this is all because your ryanodine receptor in sarcoplasmic reticulum, they allow the release, or they allow the rapid increase of the calcium, which is storing the calcium so this will be released much more into the intracellular space. So this will be causing much more of the elevated temperature. Again, muscles are mainly will be affected, where more intense contraction of the muscle. So, okay, muscle rigidity brings about acidosis, even your cardiovascular function पनि fatal हुन सक्छ. Okay, so this is a very life-threatening situation, and this thing is called as malignant hyperthermia. So hyperthermia because they are elevating the temperature. So there is also a medicine or a drug which can reverse this situation. Okay, so please note down the name of the drug. The name of the drug is dantrolene. Okay, so in this situation, malignant hyperthermia, the drug given is called as dantrolene. So this will be able to reduce the calcium release from the sarcoplasmic reticulum. Okay, बुझेको? What is malignant hyperthermia and which drug is used to treat panera? Are you clear about this?
Yes, ma'am.
Okay. So again, drugs like halothane can give hepatitis, halothane hepatitis. So chronic toxicity pani huna sakcha. Some of the drugs can have mutagenicity, teratogenic pani huncha, and also have reproductive effects. Some can even have a cancer-causing effect, which is your carcinogenicity. So what is the importance of general anesthesia in dentistry? Where are they used? But now we know what are general anesthetics. Why are they used? What are the objectives of these drugs and all? So they are mainly used in major surgeries. The dentistry ko field ma herदाखेरि maxillofacial surgeries ma they are profoundly used. Okay, and in other situations where local anesthesia or ineffective huncha, like abscess draining situations and all ma pani, and long unpleasant dentoalveolar interventions ma pani, the use of general anesthetic drugs are very important. Okay, so this is